and you're still tuned in to Salam Media with me, Salalo Mokwedere, on the Wednesday edition of News and Views. And get a load of this. The health department urges the public to get the flu vaccine in anticipation for the upcoming influenza season. The Department of Health would like to inform and urge members of the public to take extra precautionary measures to protect themselves and their loved ones against respiratory infections, which are expected to increase over the winter season. I'm sure, all of us can attest to the fact that there's been a mean flu going around, and we'll be chatting a bit on this. And just how important it is to protect yourself and your loved ones from it. And also there are discussions also about COVID-19 and, numbers of that starting to rear their ugly head. So we'll be speaking to Foster Mohale. He's the health department spokesperson, and he's joining us over the phone. Mr. Mohale, thank you so much for joining us on Salam Media, and welcome.
Good morning to you, and good morning to our listeners, and thank you for the opportunity.
First and foremost, the flu season. What is it? When is it? Because it just feels like recently it has just been flu season since 2024 has started. Is there a specific time frame on when the flu starts getting worse and spreading all over? When does it start? Do we have an idea?
Yeah, normally in South Africa the flu season is linked to the winter season, but sometimes around mid-May or early in June, but sometimes because of climate change, this changes from time to time. It gets delayed or it starts early. So this looks like it's going to start around the mid-May towards the end of June.
And I'm sure I'm not the only one that shares this sentiment, but it kind of feels like recently, or maybe after COVID-19, the flu has been really, really brutal. I mean, I've had the flu myself, and at some point was really, bedridden. Is there changes in the influenza strain in South Africa? Has it gotten worse after COVID? Is it more intense and extreme? And how can people protect themselves?
Yeah, no, you're absolutely correct. Currently, the country has been battling another strain of flu called respiratory syncytial virus, which has caused a lot of flu cases around the country. So this is just another variant or strain of flu which hit the country before the actual flu season. But the good thing about it is that it's now ending as the real flu season is kickstarting. And this has affected a lot of people, and it has severe health complications for those who contracted it. But in short, as we prepare the real flu season, we want to call upon all South Africans to say, go to your nearest public clinic or private, those who have medical aid, to get the flu shot or flu vaccine in order to protect themselves and their loved ones against serious health complications in case they contract flu.
And you speak about those that don't have medical aid. Is it free? Can you walk at any clinic and just request for the flu vaccine, and if it's available, you'll get it at no charge?
Yeah, at public clinics it's free of charge, but at private facilities like pharmacies, clinics, you have to pay. But I know a number of medical aids, they do pay, cover this flu vaccine, because they know that it's an annual condition that people go through. So, but for those who don't have, they can just walk into the nearest public clinic and get this vaccine, which is available free of charge. But as the department, we want to prioritize or call upon those who are at higher risk of serious health complications to go, especially those elderly people, 60 years and above, those with underlying conditions like your TB, your HIV, your diabetes, heart and lung diseases. Also, they need to go to clinics and private sector to get this flu vaccine to protect themselves, because they are at a higher risk of serious health complications, unlike me and you, who are young and strong.
No, noted there. And just lastly, before I let you go, COVID-19. We're seeing on the news that the numbers are going up a bit. Is it still a risk? Is it something that South Africans need to continue being concerned about? Where are we right now when it comes to COVID? Because post the lockdown period, up until now, there seems to be people still getting COVID-19, getting sick from it, and ultimately spreading it to other people.
Yeah, no, with regards to COVID-19, we have never announced that the COVID-19 is over. Even the World Health Organization has never announced that COVID-19 is over. But now, the current variant of COVID, which is circulating at a low level, is less transmissible and less severe, meaning that even if you catch, you may not experience severe health complications, unlike during the peak of COVID. So, meaning that COVID is still there. If you feel vulnerable, you can just protect yourself by exercising all those non-pharmaceutical interventions, hand wash, using sanitizer from time to time. When you cough, when you sneeze, cover your mouth. If you really feel that you are in a space where people are coughing left, right, and center without covering the mouth and nose, you can protect yourself by wearing a mask. Part of precautionary measures. But the bottom line is that the current strain of COVID is not severe, doesn't cause serious infections or complications, so people can continue to live with it without any challenges. That's like you live with other conditions like flu.
And just lastly, the vaccine for COVID-19 for this strain that you're talking about, is it still available? Can people still go to their public healthcare centers and try to get it? Do we still have the COVID vaccine available?
No, with the vaccination program has ended. All the vaccines that we had expired, so that's why we didn't worry much about securing more vaccines, because people even coming for what numbers to get this vaccine, precisely because the current strain of COVID variant is not severe. So it's just like a normal cough. Even if you test positive, you won't even feel the difference or serious complications. So it's just like a normal cough at the current moment. So hence you say people don't have to worry about the current strain of COVID, because it may not cause serious health complications.
All right. I think we're going to leave it there, Foster Mohale. Thank you so much for giving us those insights and, just shedding, light there on the upcoming influenza season. Thank you so much for joining us. We're going to leave it here for now.
Thank you very much. Keep on giving us opportunity to educate your listeners so that they can be aware and also help us to dismiss and also to empower them with health information to make health informed choices instead of relying on fake social media posts which confuses people.
All right. Thank you so much. We'll leave it there for now.